In 2006, I had an ordeal with medicine. I must have been found guilty of something. I don't feel innocent here, lurking with ghosts.
I'd gone through an ordeal with medicine, as in the title of the book, or of the first poem in the book says. And I was trying to make sense of this moment in which the doctors were going to perform for the third time a pelvic exam, and it's in this teaching hospital. And there were all of these microaggressions happening, asking about my sexual history, not believing my answers to those questions. And I blurted out, gynecology was built on the backs of Black women.
Geometry and calculus, with a run-on sentence from J. Marion Sims' Clinical Notes on Uterine Surgery.
Many persons who have never witnessed the use of my speculum doubt the correctness of my explanation of its rationale as given above.
J. Marion Sims, the father of American gynecology, started his career as a gynecologist with three enslaved women by the name of Anarcha, Betsy, and Lucy. And they all had this condition called fistula, which is the tearing of the internal organs and walls during a kind of prolonged childbirth. Anarcha is probably the most well-known of the three women because she had the most surgery. She has over 35 operations, over 34, 35 operations, and of course, without anesthesia.
There is honey and never returning to fields, salt and 35 operations, your dissection, subjection. The function of subject equals conscious mind, ego. Autobiographical retraction are ghosts in the stories.
What the microaggressions point to, or what microaggressions always point to, is a history. When marginalized people, when Black folks specifically say things like this, I feel threatened daily on my job through these microaggressions. You know, they're talking about there are ways every day that I'm told that I don't belong here. And there is evidence to show in the history of the institution in which I'm sitting in that I don't belong here. And there are reasons in my family that why I'm sitting here is extraordinary. And so this moment that is a microaggression is the story of Jim Crow, is the story of enslavement, is the story of redlining that makes my present situation seem incredibly large and then dubiously benign.
In 2006, I had an ordeal with medicine. To recover, I learned why ghosts come to me. The research question is, why am I patient?